Complete blood count, CBC, test. Presented by Ganesh Sir. SSNMEC. Shivajinagar, Bangalore. A complete blood count, CBC, is a common blood test that measures the number and types of blood cells in our body. It can be used to diagnose and monitor a variety of conditions, including anemia, infection, and leukemia. What does a CBC measure? A CBC measures the following: white blood cell count, WBC. White blood cells help fight infection. A high WBC count may indicate an infection, while a low WBC count may indicate a bone marrow disorder or other condition. Red blood cell count, RBC. Red blood cells carry oxygen throughout the body. A low RBC count may indicate anemia, while a high RBC count may indicate polycythemia, a condition in which your bone marrow produces too many red blood cells. Hemoglobin. Hemoglobin is a protein in red blood cells that carries oxygen. A low hemoglobin level may indicate anemia. Hematocrit, HCT. Hematocrit is the percentage of your blood that is made up of red blood cells. A low hematocrit level may indicate anemia, while a high hematocrit level may indicate polycythemia. Mean corpuscular volume, MCV. MCV is a measure of the average size of your red blood cells. A high MCV may indicate macrocytic anemia, a type of anemia caused by a lack of vitamin B12 or folate. A low MCV may indicate microcytic anemia, a type of anemia caused by a lack of iron. Platelet count. Platelets are blood cells that help blood clot. A low platelet count may increase your risk of bleeding, while a high platelet count may increase your risk of blood clots. Components of a CBC blood report and their normal reference ranges. Red blood cells, RBC. Normal range, 4.5 to 6.0 million cells per mcl, for men, and 4.0 to 5.5 million cells per mcl, for women. Hemoglobin, HB. Normal range, 13.8 to 17.2 grams per dl, for men, and 12.1 to 15.1 grams per dl, for women. Hematocrit, HCT. Normal range, 38.3% to 48.6%, for men, and 35.5% to 44.9%, for women. Mean corpuscular volume, MCV. Normal range, 80 to 96 femtoliters, FL. Mean corpuscular hemoglobin, MCH. Normal range, 27.0 to 33.4 picograms, PG. Mean corpuscular hemoglobin concentration, MCHC. Normal range, 32.0 to 36.0 grams per dl. Red cell distribution width, RDW. Normal range, 11.5% to 14.5%. White blood cells, WBC. Normal range, 4,000 to 11,000 cells per mcl. Neutrophils, granulocytes. Normal range, 40% to 60% of total WBC count. Lymphocytes. Normal range, 20% to 40% of total WBC count. Monocytes. Normal range, 2% to 8% of total WBC count. Eosinophils. Normal range, 1% to 4% of total WBC count. Basophils. Normal range, 0.5% to 1% of total WBC count. Platelets, thrombocytes. Normal range, 150,000 to 450,000 cells per mcl. What do the results mean? The normal ranges for CBC results vary depending on patient age, sex, and other factors. Doctor will compare patient results to these ranges to determine if they are normal. If CBC results are abnormal, it may indicate a medical condition. However, it is important to note that abnormal CBC results can also be caused by factors such as strenuous exercise, pregnancy, or certain medications. A CBC can be used to detect a variety of conditions, including anemia, infection, leukemia, lymphoma, multiple myeloma, myelodysplastic syndrome, sickle cell disease, thalassemia, nutritional deficiencies, example iron, B12, or folate, autoimmune disorders, bone marrow disorders, cancer. Here is the table showing CBC test results of adult male and female normal range values. Thanks for watching.